Hello, and welcome to the weekly dementia blog. My name is Dr. David Hutchings, and these are being again sponsored by SpectrumEd. I hope everyone had a wonderful Father's Day weekend. I know we certainly did. The kids had a lot of great stuff planned for me, so it was a nice, relaxing weekend. So let's go ahead and get started on this week. This is our third week in the series of the use of therapies, physical, occupational therapy, and also speech language pathology. And then next week we're going to go into, because we had such a large number of views on diagnosing dementia. I've had a lot more questions that have come through on that. So I want to make sure that I do talk a little bit more in depth on diagnosing a dementia, since there was a pretty big interest in that. So I have reiterated over the past 2 weeks that I constantly refer to therapies with my dementia patients. We know that they're always going to have issues with mobilities and falls, and when it comes to occupational therapy, there is just a huge amount of benefit those patients can have to receiving occupational therapy services. So the last one I want to talk about is the use of speech language pathology. And we think about that discipline based on its name. It really doesn't describe all of what they do. And in terms of that, they certainly can help dementia patients with their cognition in the early stages. And they certainly can help with some of the behaviors and things that we see from the breakdown of communication with our dementia patients. Because we mentioned in the beginning blogs, they would have the 5 A's, which is the aphasia piece. So they have word finding problems and really a lot of difficulty with expressing their wants, their needs, or even if they're in pain. But mostly what I focus on is when we refer over to the speech language pathologist is from the swallowing and nutritional and hydration issues. And I can say that on a very general standpoint, we talked about dementia staging is we see swallowing issues, a very primitive type function in the human body, begin to break down in the stage 6 range in dementia, specifically your late onset Alzheimer's disease patients. However, we can see this breakdown of the inability to eat and swallow in other dementias at earlier stages. For example, if you have a patient with a vascular dementia with a cardiovascular history and a stroke history, if you have any kind of movement disorder type of dementia associated with Parkinson's disease, MS, ALS, or even progressive supranuclear palsy, we might see some of these issues start to come into play much earlier. But I can say that as all progressive dementias move along and progress, 100% of our patients are going to have issues with this function. So what happens when a patient does have issues with this? What are the ramifications? Well, one of the biggest ones is that the patient's going to have a greater chance of developing a respiratory infection or pneumonia. So if we see that your loved one or your patients have multiple respiratory infections, repeated pneumonias, this is something I would certainly think about asking your doctor to make sure that we get a referral over for the swallowing and the speech language pathologist to come in. The other pieces are we do see dehydration and malnutrition and weight loss, and these can be catastrophic because patients can have an increased confusion because of the dehydration issues and the weight loss. But then it kind of snowballs, and you can have the development of wounds, and there's a lot of other things that can cause, from this swallowing issue. Some of the symptoms that we'll see patients have, or maybe that takes longer for them to eat a meal. They'll have a long time in the chewing. They'll just chew for a long periods of time. And then you'll actually see some of the aspiration symptoms, which that simply means that there's materials that they're eating, food or liquid, that are getting into the lungs. And this can be runny eyes when we're eating, runny nose, coughing, hiccups, gurgly vocal qualities. So there's a lot of things that come in there. So think about it almost like when you swallow down the wrong tube and you cough and your nose runs and all these things. Well, you kind of take away the cough reflex and you have those same symptoms. And unfortunately, many times these are masked or misdiagnosed for symptoms of allergies. So those are very important because our patients are a huge risk for developing pneumonia in this patient population. It is very treatable. I can tell you that I'm not a huge fan of getting a recommendation back and we want to make liquids really really thick and these types of things because that can make things worse too. But there are treatments that the clinicians can use and definitely consult with your speech language pathologist on specific personalized treatments that they can use to help increase intake so we're meeting nutritional needs. Also, SpectrumMed does offer a clinical program that's designed for dementia patients and allows them also to use different types of treatment methods that may not have been used before, like the use of biofeedback and the use of electrical stimulation to help treat the swallowing. So the good thing is it's treatable, and we don't have to think about the use of feeding tubes anymore in this population because there is, and this is strong for me to say this, but there's absolutely no evidence whatsoever that a feeding tube helps a patient with a progressive dementia. So definitely utilizing your speech language pathologist for this treatment and knowing that there is advanced treatments out there like clinical programs that SpectrumMed offers that can help and assist in improving intake for these individuals and helping them decrease the chance of pneumonia and a hospitalization. So again, next week we're going to dive back into the diagnosis of dementia and kind of backtrack a little bit with that and address a lot of the questions that's come in with that. Very excited with all the wonderful questions and views we're getting from these blogs, and we're really helping the caregivers and the practitioners. So we will keep the videos coming every single week, and definitely if you have any questions or thoughts about future topics, please feel free to reach out to us. Thank you.